In this video, I will talk about the mad cow disease. So what is the mad cow disease? BSE, bovine spongiform encephalopathy, or mad cow disease, is a progressive neurological disorder of cattle that results from infections by an unusual transmissible agent called a prion. The nature of the transmissible agent is not well understood. Currently, the most accepted theory is that the agent is a modified form of a normal protein known as prion protein. For reasons that are not yet understood, the normal prion protein changes into a pathogenic, which is harmful form that then damages the central nervous system of cattle. Next is the history of mad cow disease. BSE was first recognized and defined in UK in November 1986. From 1987 until 2007, UK has reported more than 180,000 cases of BSE and counting, from 97% of all cases reported throughout the world. The causes of disease is because of the infectious agent in bovine spongiform encephalopathy is a specific type of misfolded protein called prion. Prion can be transmitted to humans by eating food contaminated with them. Prions are not destroyed even if the beef or material containing them is cooked or heat treated. Prion proteins carry the disease between individuals and cause deterioration of the brain. Then, BSE is a transmissible disease that primarily affects the central nervous system, brain, and spinal tissue. It is a form of transmissible spongiform encephalopathy like Creutzfeldt-Jakob disease in humans, scurvy in sheep, chronic wasting disease in corvids. The spread of this disease in cattle is caused by feeding rendered material from infected cattle back to other cattle. Besides that, the signs and symptoms of BSE has a long incubation period, which is 2 until 8 years. Clinical signs of BSE are found in adult animals. Symptoms may last for a period of 2 to 6 months before the animals die. Animals with BSE may demonstrate some of the following symptoms, which are nervous or aggressive behavior, depression, hypersensitive to sound and touch, twitching, tremors, abnormal posture, lack of coordination and difficulty in rising from a lying position, weight loss, decreased milk production. Now, diagnosis. The BSE testing protocol calls for an initial rapid test called an enzyme-linked immunosorbent assay, ELISA. If the ELISA test is inconclusive, samples are sent for confirmatory testing to the National Veterinary Service Laboratories (NVSL). An immunohistochemistry test, Western blot, is conducted at National Animal Disease Center (NADC). The tests are designed to detect the presence of BSE-specific abnormal prion protein in the brain tissue. For the vaccination and prevention, there is no effective vaccine. We can do a ban on feeding meat and bone meal to cattle from countries where the disease was present, or surveillance measures, and blood or plasma donation restrictions. While for the treatment, there is no treatment for BSE. Some of the symptoms can be managed, and treatment is palliative care. That's all from me. Thank you. My name is Hanan Sofia Benti Labri, and I'm from RIS 1204C, and my matric number is 2019228028.